Hello, and welcome to Annals Animated. Our video will look at the association between the availability of hospital-based palliative care and treatment intensity for critically ill patients. A paper by Dr. Mei Hua and colleagues published in the September 2018 issue of the Annals of the American Thoracic Society. Palliative care interventions are known to decrease treatment intensity in critically ill patients. In the current study, the authors sought to explore whether the availability of hospital-based palliative care services in a real-world setting is associated with lower treatment intensity and healthcare resource utilization. The study found that inpatient palliative care services were not associated with a meaningful decrease in treatment intensity as measured by the duration of hospitalization. However, patients treated in hospitals with inpatient palliative care services were more likely to be discharged to hospice compared to those in hospitals without palliative care. The authors studied 1,025,503 adults hospitalized between 2008 through 2014 in an intensive care unit in any of the 151 hospitals in New York State included in the statewide Sparks database, merged with hospital survey and palliative care registry data. Of the 151 hospitals, 86 had mature palliative care services. 37 had nascent programs that developed during the study period. 28 did not have a palliative care program. 80% of patients received care in a hospital with a palliative care program. Palliative care programs were more common in teaching hospitals, facilities with 400 or more beds, hospitals with higher volume of admissions, surgeries, and full-time employees. Hospitals with and without palliative care programs were matched on hospital-level variables using AHA data. Similar to previous studies evaluating palliative care services, the primary outcome was the length of hospitalization. Hospital length of stay was similar for patients in hospitals with and without palliative care programs, with a median length of stay of 6 days in both groups. Among those who died during hospitalization, the median length of stay was 8 days in both groups. However, discharge to hospice care occurred more frequently among patients in hospitals with a palliative care program compared to those without. Enteral or parenteral nutrition was used less frequently in patients treated in hospitals with palliative care. Other secondary outcomes did not differ between groups. Strengths of this study include sensitivity analyses that indicated a robust primary analysis without evidence of a significant unmeasured confounder. The study was also one of the first to evaluate real-world palliative care programs already in place across a large number of U.S. hospitals, suggesting that the findings may be generalizable to the U.S. population. In summary, while inpatient palliative care services did not appear to influence hospital treatment intensity, the availability of inpatient palliative care services may promote discharge to hospice care.